Hey, have you ever felt that strange tingling or numbness in your hands or feet and just brushed it off? It's surprisingly common. About 20 million people in the US alone suffer from peripheral neuropathy, a condition where nerve damage causes pain, weakness, or loss of sensation. What's tricky is that nerve damage often creeps up silently, sometimes linked to diabetes, chemotherapy, infections, or even vitamin deficiencies. Before you know it, it can seriously affect daily life. Imagine struggling to hold a cup or walk without stumbling, all because your nerves aren't firing signals properly. That's why catching these issues early and supporting nerve health naturally is so important. Prevention beats the pain every time. Now, let's talk about something that often gets overlooked but is absolutely crucial: vitamins that help repair nerve damage. Vitamins aren't just about keeping your skin glowing or bones strong. Some play a major role in restoring and protecting your nervous system. Today, I want to walk you through the top 5 vitamins that science shows can actually help repair nerve damage, how they work in your body, and why including them in your diet could be a game changer for anyone facing nerve-related issues. First up, vitamin B12. Vitamin B12 is truly one of the most crucial vitamins when it comes to maintaining and repairing nerve health. Do you know that the deficiency in B12 is one of the leading causes of peripheral neuropathy worldwide, affecting up to 15% of older adults? The active form of B12, called methylcobalamin, plays a vital role in forming and maintaining the myelin sheath, which is essentially the protective insulating layer around your nerves. This sheath ensures that electrical signals travel quickly and efficiently between your brain, spinal cord, and the rest of your body. Without sufficient B12, this myelin can break down, leading to nerve damage and symptoms like numbness, tingling, and weakness, classic signs of peripheral neuropathy. Research has shown that B12 deficiency is surprisingly common, especially among older adults and vegetarians, who might not get enough from their diets or have trouble absorbing it properly. One study published in Neurology highlighted that around 20% of older adults suffer from B12 deficiency, which directly correlates with increased risks of neuropathy and cognitive decline. Another clinical trial by the American Journal of Clinical Nutrition demonstrated that patients with diabetic neuropathy who received methylcobalamin injections experienced significant improvement in nerve conduction velocity and reduced symptoms of pain and numbness. The science behind how B12 helps repair nerves is fascinating. Methylcobalamin supports DNA synthesis, which is essential for the production and repair of nerve cells. It also helps maintain the fatty layer, the myelin sheath, ensuring that nerves are insulated and protected from damage. In addition to nerve repair, B12 supports the formation of red blood cells, which are responsible for carrying oxygen throughout your body. Oxygen is critical for nerve cells to function properly and heal, so without enough B12, your nerves simply don't get the energy and oxygen they need. For those who may not be familiar, our bodies can't produce vitamin B12 on their own, so we rely entirely on dietary intake or supplementation. Animal products like meat, fish, eggs, and dairy are the richest sources. However, many people, especially vegans and vegetarians, are at higher risk of deficiency because plant-based foods don't naturally contain B12. Also, as people age, their ability to absorb B12 from food decreases, which is why deficiency is more common in seniors. That's why fortified cereals and supplements become important alternatives. The recommended daily intake for adults is about 2.4 micrograms, but in therapeutic settings, especially for nerve repair, doses can be significantly higher, often administered under medical supervision. High-dose methylcobalamin injections have been used safely and effectively in treating neuropathies related to diabetes and other conditions. It's interesting to note that combining B12 with folate and other B vitamins enhances its nerve-repairing properties, as these vitamins work together in key metabolic pathways that support nerve health. People with diabetes, those undergoing chemotherapy, or individuals with chronic alcohol use are among those who might benefit the most from B12 supplementation, given their increased risk for nerve damage. However, while B12 is generally safe, It's always wise to consult a healthcare professional before starting high-dose supplements, especially if you have underlying conditions or are on medication. Next, vitamin B6, known scientifically as pyridoxine, also plays a crucial role. Vitamin B6, scientifically known as pyridoxine, plays a vital and fascinating role in nerve health, particularly in the production of neurotransmitters, those chemical messengers that nerves rely on to send signals across your body. Think of neurotransmitters as the language your nervous system uses to communicate. Without B6, your body struggles to create these essential chemicals like serotonin, dopamine, and gamma-aminobutyric acid, GABA, all of which are critical for proper nerve function and mood regulation. This means that a deficiency in B6 can disrupt nerve communication, leading to symptoms like numbness, tingling, burning pain, or even muscle weakness. Interestingly, B6's relationship with nerve health has a unique Goldilocks effect. It's all about balance. Too little B6 can cause nerve damage and neuropathy, but too much can be just as harmful. Prolonged intake of excessively high doses, particularly above 100 milligrams daily, has been linked to sensory neuropathy, a condition where nerve function is impaired, leading to pain, numbness, and coordination problems. This paradox makes B6 one of the vitamins where dosage matters tremendously and careful management is essential. In proper amounts, B6 supports nerve repair by contributing to the synthesis of myelin, the protective sheath around nerves that ensures electrical impulses travel quickly and efficiently. By helping maintain myelin integrity, B6 improves nerve signal transmission, which is especially important in conditions like carpal tunnel syndrome and peripheral neuropathies. Research has shown promising results where B6 supplementation helped reduce symptoms in these conditions. For example, a study published in the Journal of Neurology observed that patients with carpal tunnel syndrome who received B6 supplements reported improvements in pain and numbness compared to those who did not. B6 also works synergistically with other B vitamins, such as B12 and folate, to support nerve regeneration and overall neurological health. This combination enhances their effects by supporting key metabolic pathways, including those involved in DNA synthesis and repair, neurotransmitter production, and energy metabolism. Because of this synergy, many supplements designed for nerve health include a B-complex rather than isolated B6 alone. Dietary sources of B6 are abundant and easy to incorporate into your meals. Foods like poultry, fish, bananas, potatoes, and fortified cereals provide a natural way to maintain adequate B6 levels. The recommended daily allowance for adults is about 1.3 to 2 milligrams, which is generally sufficient to support nerve function and prevent deficiency. However, in clinical settings, higher doses may be used temporarily under medical supervision to address neuropathic symptoms. It's important to highlight that B6 deficiency, though less common than in the past due to improved nutrition, can still occur in certain groups. People with kidney disease, alcohol dependence, or malabsorption disorders are at increased risk of low B6 levels. Symptoms of deficiency often include numbness, irritability, and muscle weakness. Conversely, excessive supplementation without medical advice can be risky, so it's crucial not to self-prescribe high doses. People dealing with nerve pain from conditions like diabetic neuropathy, carpal tunnel syndrome, or chemotherapy-induced neuropathy may benefit from B6 supplementation as part of a broader treatment plan. However, given the narrow therapeutic window of B6, consulting a healthcare professional before starting supplements is key to avoid toxicity. Vitamin D might not be the first thing you think of for nerves, but it's turning out to be surprisingly important. Vitamin D, often called the sunshine vitamin, holds a special place in nerve health because its receptors are found right on nerve cells themselves. This means vitamin D doesn't just work on bones and calcium regulation. It actually plays a direct role in how our nerves grow and repair. One of the ways it helps is by reducing inflammation, which is a major driver of nerve damage and neuropathic pain. Inflammation can make nerves hypersensitive and slow down their healing. So vitamin D's anti-inflammatory effects are incredibly important for anyone struggling with nerve issues. Research has consistently shown a strong connection between low vitamin D levels and an increased risk of neuropathic pain, particularly in people with diabetes. Diabetic neuropathy, one of the most common nerve disorders worldwide, affects nearly half of all people with diabetes at some stage, according to multiple studies. Vitamin D's protective mechanism here involves promoting nerve regeneration and shielding nerves from oxidative stress, the damage caused by harmful free radicals, and inflammation, both of which accelerate nerve degeneration. A notable study published in Pain Medicine highlighted that diabetic patients with neuropathy who were deficient in vitamin D experienced a significant reduction in their pain levels once their vitamin D deficiency was corrected. This isn't just about feeling better. It reflects real biological improvements in nerve function. Vitamin D influences the production of nerve growth factors, which are essential proteins that help damaged nerves regenerate and maintain their health. Without enough vitamin D, this healing process slows down, leaving nerves vulnerable to ongoing damage. Most people get their vitamin D naturally through sunlight exposure, which triggers vitamin D synthesis in the skin. Fatty fish like salmon and mackerel, along with fortified foods such as milk and cereals, are also good sources. However, vitamin D deficiency is surprisingly widespread, especially in regions with limited sunlight during winter months or among people who spend most of their time indoors. Globally, studies estimate that around 1 billion people have insufficient vitamin D levels, which can silently worsen nerve health over time without obvious symptoms. The recommended daily intake for adults is generally around 600 to 800 international units, IU. Still, many experts agree that higher doses might be necessary to restore optimal levels, especially for those with confirmed deficiency or nerve damage. Such higher doses should always be taken under medical supervision to avoid potential side effects, like elevated calcium levels or kidney problems. An interesting aspect of vitamin D's benefits for nerves is how it works well in combination with other minerals like calcium and magnesium. Calcium is vital for nerve signal transmission and muscle contraction, while magnesium helps relax muscles and supports nerve function. Together, these nutrients create a supportive environment not only for nerve repair, but also for easing muscle weakness and cramps that often accompany neuropathies. For anyone experiencing nerve pain, tingling, or weakness, especially if they have diabetes or other risk factors, checking vitamin D levels and addressing any deficiency can be a game changer. It's a natural, evidence-based approach that complements other treatments and supports long-term nerve health. Of course, because vitamin D impacts multiple body systems, including bones, immunity, and mood, maintaining adequate levels benefits your whole well-being, not just your nerves. So, whether you're getting outside more, adding fatty fish to your diet, or taking a supplement recommended by your doctor, vitamin D is a vital part of protecting and repairing your nervous system. Moving on, vitamin E is a potent antioxidant that protects nerve cells from oxidative damage, one of the major causes of nerve degeneration. Nerves are particularly vulnerable to oxidative stress because their membranes are packed with polyunsaturated fats, which are especially prone to damage from free radicals, those unstable molecules that wreak havoc by attacking cell structures. Vitamin E steps in as a powerful antioxidant, neutralizing these free radicals before they can break down the delicate nerve cell membranes. This protective action helps preserve the integrity of nerve cells, preventing damage that can lead to symptoms like pain, numbness, and weakness. Clinical evidence supports the role of vitamin E in nerve health. Several trials have shown that vitamin E supplementation can improve nerve function and reduce neuropathic symptoms, particularly in people suffering from diabetic neuropathy, one of the most common and debilitating forms of nerve damage worldwide. For example, a study published in Diabetes Care found that patients who took vitamin E supplements experienced better nerve conduction and less pain compared to those who didn't. This highlights how vitamin E doesn't just mask symptoms, but supports actual nerve repair. The most biologically active form of vitamin E is alpha-tocopherol, which is especially effective in protecting nerve cells against oxidative damage. You'll find this nutrient in everyday foods like nuts, almonds and hazelnuts stand out. Seeds, vegetable oils such as sunflower and safflower oil, and green leafy vegetables like spinach. These sources make it easy to include vitamin E in your diet naturally. The recommended daily intake for adults is about 15 milligrams, which is generally enough to support antioxidant protection for nerve health. While vitamin E supplements are typically safe, it's important to be cautious with dosage. Taking very high doses, especially above 1,000 milligrams per day, has been linked to an increased risk of bleeding because vitamin E can affect blood clotting. This means if you're on blood thinners or have bleeding disorders, it's crucial to talk to a healthcare provider before starting any vitamin E supplements. Incorporating vitamin E through diet or moderate supplementation can be a valuable part of a nerve-supportive lifestyle, especially when paired with other vitamins and minerals that promote nerve repair and function. It's one of those nutrients that quietly but effectively protects your nervous system from damage caused by everyday oxidative stress, helping you maintain healthy nerves and reduce neuropathic discomfort. Last but definitely not least, vitamin B1, also called thiamine, is essential for nerve energy metabolism. Thiamine, or vitamin B1, plays a crucial role in nerve health by helping convert carbohydrates into energy. It is essential because nerves require a constant and reliable supply of energy to function properly and repair themselves when damaged. Without sufficient energy, nerve cells struggle to maintain their electrical signals and repair damaged tissue, leading to symptoms like weakness, numbness, and pain. Historically, a severe deficiency of thiamine causes a condition called beriberi, characterized by profound nerve damage, muscle wasting, and even cardiovascular complications. While beriberi is now rare in developed countries due to improved nutrition, mild thiamine deficiency or suboptimal levels can still impact nerve health and overall neurological function. One of the most interesting advances in thiamine research is the use of benfotiamine, a fat-soluble form of thiamine that is more easily absorbed by the body. This form has shown significant promise in treating diabetic neuropathy, a nerve disorder affecting nearly half of people with diabetes worldwide. High blood sugar levels produce harmful compounds known as advanced glycation end products, AGEs, which damage nerves and impair their ability to function. Benfotiamine helps counteract this process by blocking the pathways that lead to AG formation, thereby protecting nerves from this toxic effect. Clinical studies support benfotiamine's role in improving nerve function. Research published in Diabetes Research and Clinical Practice demonstrated that patients with diabetic neuropathy who took benfotiamine experienced improvements in nerve conduction velocity, meaning their nerves could send signals more efficiently. Additionally, these patients reported a reduction in painful symptoms like burning, tingling, and numbness. These effects suggest that benfotiamine not only alleviates discomfort, but also supports the underlying repair and regeneration of nerve fibers. Dietary sources of thiamine include whole grains, legumes like beans and lentils, and pork, making it relatively easy to meet daily needs through a balanced diet. The recommended daily intake for adults is around 1.1 to 1.2 milligrams, which supports normal metabolic and neurological functions. However, in therapeutic contexts, such as treating neuropathy, higher doses of benfotiamine are often used but should always be supervised by a healthcare professional to ensure safety and effectiveness. It's also important to note that thiamine works best when combined with other B vitamins, such as B6 and B12. This B vitamin synergy supports various metabolic pathways critical for nerve repair, DNA synthesis, and neurotransmitter production, making the combination more effective than any single vitamin alone in promoting neurological health. People at risk of thiamine deficiency include those with alcohol dependence, malabsorption disorders, or chronic illnesses like diabetes, where nerve damage is a common complication. For these groups, monitoring thiamine status and considering supplementation can be a vital part of managing nerve health and preventing the progression of neuropathy. So, who can benefit most from these vitamins? People with diabetes, chemotherapy patients, those with chronic alcohol use, or anyone experiencing early signs of nerve issues like numbness or burning sensations should definitely consider incorporating these vitamins, ideally after checking levels with a healthcare provider. But caution is important. Some vitamins like B6 in excessive amounts or high doses of vitamin E can cause adverse effects, so more isn't always better. Pregnant or breastfeeding women and people with certain medical conditions should always consult their doctor before starting supplements. Incorporating these vitamins through a balanced diet rich in whole foods is the best starting point. Think lean meats, fish, nuts, seeds, whole grains, leafy greens, and fortified products. Supplements can fill in the gaps, especially for people with absorption issues or higher needs. And pairing these vitamins together often boosts their nerve-repairing effects because they work synergistically, supporting different pathways of nerve health from energy metabolism to antioxidant protection and myelin repair. Keep in mind, vitamins alone aren't miracle cures. They're powerful tools as part of a holistic approach, including good blood sugar control, avoiding toxins like excessive alcohol, staying active, and managing inflammation. If you're dealing with nerve pain or numbness, try focusing on these vitamins for a few weeks and notice how your symptoms respond. And don't forget, sharing your journey in the comments can help others too. So, next time you feel a little tingle or numbness, remember these vitamins are your nerves' best friends. Try adding a bit more B12-rich foods, some sunshine for vitamin D, and a handful of nuts for vitamin E, and see how your body thanks you. Your nerves will appreciate it more than you think. Give it a shot for a week, and let me know how you feel.